Okay, so hemophilia. What is hemophilia? Hemophilia is a rare disorder that causes excessive bleeding and slows down the blood clotting process. So basically, people who suffer from it are prone to bleeding out and having other complications due to this disorder. There are three major types of hemophilia, but the most common ones are hemophilia A and hemophilia B. Hemophilia A is known as the classic hemophilia, and hemophilia B is known as the Christmas disease. Okay, so the cause of hemophilia A are mutations in the gene coding for factor VIII. Hemophilia B is caused by mutations in the gene coding for factor IX. So basically, hemophilia A and hemophilia B are caused by mutations that happen in different genes, but both of those genes are both situated in the X chromosome. And so that causes blood clotting to happen at a much slower rate. And this is why people bleed excessively, because they never heal, so they just keep bleeding. Differences between hemophilia types. Hemophilia A and B are both the most common, but out of those two, the most common one is hemophilia A, known as the classic hemophilia. So hemophilia A is caused by the deficiency of factor VIII. Hemophilia B is caused by the deficiency of factor IX, and then hemophilia C is the least common, and it is common in both men and women, unlike the first two that we listed. And hemophilia C is caused by a deficiency of factor XI. What are the symptoms of hemophilia? Although all people who suffer from hemophilia basically have the same symptoms, which are excessive bleeding, they vary depending on how severe it is. So people who have more severe cases of hemophilia may experience more severe symptoms of hemophilia, although they are all linked to bleeding. So some examples of the symptoms people can have are deep bruises, blood and urine/stool, bleeding gums, frequent nosebleeds, and other symptoms. People who have severe cases of hemophilia tend to bleed internally for no reason. People with hemophilia usually experience symptoms at a young age, around 2 or 3 years old, and usually the people who experience these symptoms young are born with the disease already, so it runs in their family. And then in rare cases, some people can develop the hemophilia later on in life. Is it painful to suffer from hemophilia? Not everyone who suffers from hemophilia experiences pain, but some do. So the people who do experience pain usually feel it in the joints, like the knees and etc. According to some studies that were done in Europe, 20% of children who suffer from bleeding disorders deal with pain, and 35% of adults suffer from chronic pain. So like I said before, some people experience pain, others don't. Some, if not most, of the people who suffer from hemophilia know that they do, because since it is a hereditary disease, previous family members suffer from it, so they know what they're experiencing. And although it is easy to self-diagnose, it is not recommended to do so, because since it is a hereditary disease, and women are carriers of it, a girl or a woman can have it and you may not know you have it. So it is important to go get diagnosed with it and not just assume that you don't have the disease, because you really never know. Women are carriers of the disease. It is known that women are carriers of hemophilia, but they rarely have any symptoms. A woman who is a carrier of hemophilia can pass the disease onto her children. Although it is not impossible for a woman to suffer from excessive bleeding and complications due to hemophilia, it is very rare. This is why it's vital for people to get tested if hemophilia runs in the family. So let's say, for example, if a couple, mom and dad, get married and the mom is a carrier of hemophilia, she can pass it on to her children. Let's say she has one girl and one boy. The girl can be a carrier of hemophilia and the boy can have hemophilia and he can show symptoms of hemophilia. The girl won't show any symptoms, but she will be able to carry on with that disease and pass it on to her children. And this is how it keeps on spreading, and again, that's why it's important for everyone in the family to get tested. Is there a cure for hemophilia? Although hemophilia is considered a rare disorder, unfortunately, there's no cure for this disease. Since hemophilia has no cure, there's some treatment that can help with each different types of severeness: mild, moderate, severe. For instance, mild hemophilia can be treated with DDAVP to raise the body level of the factor VII. Moderate hemophilia might need People with moderate hemophilia might need replacement therapy and a DDAVP if necessary. For example, if they ever start bleeding while doing a hobby. And then for severe hemophilia, you actually need replacement therapy so the blood won't damage any important parts of the body. This therapy is given out 2 or 3 times a week for the rest of the life of the patient. Some medications that also help are DDAVP or Stimate, and etc. So basically, then again, the treatments that you can use for hemophilia vary depending on the severeness of a person's hemophilia. How can hemophilia be treated? Although hemophilia has no cure, there is treatment options people can use to live their best life possible. One of the best ways to treat hemophilia is to replace the missing blood clotting factor that helps the blood clot decently. In order to do this, treatments need to be injected into the person's veins. The treatments available are plasma-derived factor concentrates, recombinant factor concentrates, and others. Is hemophilia deadly? Hemophilia can be deadly when excessive bleeding occurs in important organs such as the skull. So then again, it really just depends on how severe a person's hemophilia is. People who suffer from severe hemophilia tend to bleed internally, and this can cause damage to important organs and can lead to death. Percentages of hemophilia. About 10% of people who suffer from severe hemophilia experience bleeding in the skull. 30% of people with severe cases of hemophilia die. And a third of hemophilia deaths occur due to bleeding in the skull. 25% of young people with severe hemophilia have below normal motor skills and usually perform daily normal activities such as school, sports, chores, and others at a less productive rate than other people their age. Past kings and queens / public figures with hemophilia. Queen Victoria from England was believed that she had hemophilia B and had passed it on to 3 of 9 children. Queen Victoria died around the 1940s, and her son, who was 30 years old, died of a hemorrhage. Jesse Schrader was a baseball player who had severe hemophilia A, and he had to ice his arms after each game. More about hemophilia. It is said that hemophilia is a common disease in royalty because of the mixture of bloods. Hemophilia C affects men and women equally, unlike hemophilia A and B. Hemophilia A is 4 times more common than hemophilia B, although they are both the most common types of hemophilia. 1 in 5,000 men suffer from hemophilia A. What age group is more affected by hemophilia? Most people who have hemophilia are diagnosed at a young age, and men are most affected by hemophilia. It is actually very rare for a woman to be affected with hemophilia, especially if it's type A or type B, because, like I said before, women are only carriers, and men are the ones who experience the symptoms of the disease.